This conference will now be recorded.
Hello, everyone. A warm welcome to CM Dental Academy. It's an online dental education platform in the field of dental surgery. We aim at delivering excellent quality online training programs and courses for dental students under the guidance of eminent mentors. The subjects will be covered in all the formats such as live lectures, descriptive notes, MCQs, and Viva Voce questions. So, what are you waiting for? Come, let's begin a journey towards success. In today's lecture, we'll be dealing with introduction and roots of drug administration. The highlight in the introduction, source of drugs, drug nomenclature, dosage forms of drugs, prescription and non and roots of drug administration. Pharmacology is the science of drugs. The word pharmakon is a Greek word which means drug and logos means discourse in. It mainly deals with the interaction of externally or exogenously administered chemical molecules within the living systems. What is a drug? It is any chemical substance which can produce a biological response. It further divided into pharmacodynamics and pharmacokinetics. The pharmacodynamics mainly deals with what the drug does to the body. In Greek, dynamis means power. It mainly includes physiological and biochemical effects of drugs and their mechanism of action at organ system or subcellular or macrocellular levels. For example, whenever the adrenaline is injected, it interacts with the adenoceptors, then the G protein mediated stimulation of cell membrane bound adenyl cyclase is induced, which increases the intracellular cyclic 3 and 5 adenosine monophosphate levels, further which stimulates the cardiac tissues, then hepatic glycogenolysis and hyperglycemia. So these are the series of events after the administration of drug into the body occurs. So the pharmacodynamics is that part of pharmacology which deals with the effects of drug on body. The pharmacokinetics. Kinesis means the movement. In pharmacokinetics, we'll be studying what the body does to the drug, what the response of our body after the administration of a drug. It refers to the movement of the drug in and alteration of the drug by the body, mainly its absorption, distribution, its binding capacities, localization, storage, biotransformation, and excretion of the drug. For example, whenever a paracetamol is rapidly and almost completely absorbed orally, when it is ingested, it attains its peak blood level within 30 to 60 minutes, out of which 25% is bound to plasma proteins, widely and almost uniformly distributed in the body. It is extensively metabolized in liver, primarily by glucuronide and sulfate conjugation into inactive metabolites, which are excreted in urine and has a plasma half-life of 2 to 3 hours and clearance value of 5 ml per kg per minute. Once the drug is administered by any form or route, how the drug acts in a body, what are the body responses, where it is metabolized, how it is excreted through the body when it attains the maximum peak level in the blood, and how long is going to be the duration of action of the drug. These all points regarding a drug will be studied under pharmacokinetics. So, what is a drug? How the drug word is derived? Drug word is derived from a French word drogue, which means a dry herb. It's a single active chemical entity present in medicine that is used for diagnosis, prevention, treatment, or cure of any disease. That's why WHO has put forward a definition of a drug in 1966. Drug is any substance or product that is used or is intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient. Whenever defined drug is being asked, this is the standard definition of a drug put forth by WHO. Where all we use the term drug, what are the significance of this? The term drugs is being also used to mean addictive or abuse substances. However, this restricted and derogatory sense usage is unfortunate degradation of a time on a term. Thus, drug should refer to a substance that has some therapeutic or diagnostic application. Few other important aspects of pharmacology, such as pharmacotherapeutics. It is the application of pharmacological information together with the knowledge of the disease, just not only the administration of the drug, such as which drug is effective against which type of disease. For its prevention, mainly, then mitigation or cure. So, selection of most appropriate drug, dosage, and duration of treatment in accordance with the specific features of a patient are part of pharmacotherapeutics. Clinical pharmacology. It is the scientific study of drugs, both new and old one, in human beings. It mainly includes the pharmacodynamic, pharmacokinetic investigation in healthy volunteers and in patients. Evaluation of efficacy and safety of drugs and comparative trials with other forms of treatment. Surveillance of patterns of drug use, adverse effects, etc., are dealt under with clinical pharmacology. The aim of this is to generate data for use of drugs and for practice of medicine to be evidence based. Chemotherapy. It is the treatment of systemic infection or malignancy with specific drugs that have selective toxicity for the infecting organism or malignant cell with no or minimal effects on the host cells. These are the further divisions of pharmacology. So, drugs in general can be divided into pharmacodynamic agents and chemotherapeutic agents. What are the pharmacodynamic agents? These are mainly designed to have pharmacodynamic effect in the recipient. And the chemotherapeutic agents are designed to inhibit or kill invading parasite or any malignant cell and have no or minimal pharmacodynamic effect in the recipient. So, what exactly the branch pharmacy deals with? It is the art and science of compounding and dispensing drugs or preparing suitable dosage forms for administration of drugs to man or animals. Mainly includes collection, identification, purification, isolation, synthesis, standardization, and quality control of medicinal substances. The large-scale manufacture of drug is called pharmaceutics. It is primarily a technological science. Toxicology is the study of poisonous effect of drugs and other chemicals such as household, environmental pollutant, industrial, agricultural, homicidal, with emphasis on detection, prevention, and treatment of poisonings. It also includes the study of adverse effects of drugs. When the excess administration of dosage causes the side effects, what are the consequences of it, and how to deal with this? Since the same substance can be a drug or a poison, depending on the dosage. So, toxicology mainly deals with this. After dealing with the important branches of the pharmacology, what do they deal with, what are their function, and how it works all together? What are the sources of drug we are going to study? Drugs are obtained from variety of sources such as plants, animals, microbes, minerals, synthetic chemicals, biotechnological products. Many plants contain biologically active substances and are the oldest and known source of the drugs. Since ancient times, the documentation of preparation of drugs using plants has been recorded. Chemically, the active ingredients fall in several categories whenever we are considering plant as a source of drug. The chemical composition present in plants, such as alkaloids, glycosides, oils, and other plant products like tannins. For alkaloids, these are alkaline nitrogenous bases having potent activity. These are most important category of vegetable origin drugs. Few prominent examples being the morphine, atropine, ephedrine, nicotine, ergotamine, quinine. They are mostly used as their water-soluble hydrochloride or sulfate salts, mainly the alkaloids. Glycosides are the compounds consist of heterocyclic non-sugar moiety linked to the sugar moiety through either linkage. Cardiac glycosides, such as digoxin, are the best known glycosidic drugs. Aminoglycosides, such as gentamicin, are antibiotics obtained from microorganisms and have an amino sugar in place of sugar moiety. Oils are viscous, inflammable liquids insoluble in water. Fixed oils are calorie yielding triglycerides of higher fatty acids. These are mostly used for food and as emollients. For example, the groundnut oil, coconut oil, sesame oil. Castor oil is a stimulant purgative. Essential oils, mostly obtained from flowers or leaves, are aromatic, such as terpene hydrocarbons that have no food value. They are used as flavoring agents. Carminators, counterirritants, and astringents are examples such as eucalyptus oil, then peppermint oil, nilgiri oil, etc. Then the clove oil is used to allay dental pain. Menthol, thymol, camphor are volatile oils that are solids at room temperature and are included in mouthwashes, toothpaste. Few mineral oils are not plant products though, but obtained from petroleum. Liquid paraffin is a lubricant laxative. Soft and hard paraffin are used as emollient and as ointment bases. Other plant products like tannins are astringent, gums are demulcent and acts as suspending agents in liquid dosage forms. Glycerin is a viscous sweet liquid used as a vehicle for gum or throat paint. Resins and balsams are also used as antiseptic and in cough mixtures. The anti-malarial drug is a endoperoxide obtained from a Chinese plant. Few plant products, such as though animal parts have been used as cures since early times, it was exploration of activity of organ extracts in the late 19th and 20th century that led to the introduction of animal products into medicine. For example, being the adrenaline, thyroxine, insulin, liver extract. Antisera and flu vaccines are also produced from animals. Microbes, these are the antibiotics obtained from fungi, antimycosis, bacteria, etc., such as penicillin, the gentamicin, tetracycline, erythromycin, polymyxin B, actinomycin D. Some enzymes such as diestrase from a fungus and streptokinase from streptococci have a microbial source. Vaccines are produced by the use of microbes. The minerals, few minerals such as iron, salt, calcium salts, lithium carbonate, magnesium, aluminium, hydroxide, iodine are used as medicinal substances. Synthetic chemicals, synthetic chemistry made its debut in 19th century and is now the largest source of medicine. Not only diverse congeners of naturally obtained drugs such as atropine substitutes, adrenergic B2 antagonists, synthetic glucocorticoids, progestins, cephalosporins, etc., have been introduced to achieve greater selectivity of action or even novel type of activity. But many entirely synthetic families of drugs, such as benzodiazepines, thiazides, benzomidazoles, and fluoroquinolones, etc. Biotechnological products. Several drugs, especially peptides and proteins, are now produced by recombinant DNA technology. Human growth hormone, insulin, alteplase, interferon, etc. Monoclonal antibodies, regular peptides, erythropoietin, and other growth factors are the newer drugs of biotechnological origin. These being the various variety of diverse sources of the drugs, where all these drugs, depending upon their preparation, are injected into the individuals as per the need. How the naming system or nomenclature of a drug is carried out. Drugs are generally have mainly three categories by names, such as the chemical name, then comes the non-proprietary name, and the brand name itself or the proprietary name. What the chemical name stands for? It describes the substance chemically. That is, the chemical formulation of a substance is just the chemical name. Non-proprietary name, it is the name accepted by a competent scientific body or a authority, like United States adopted names or British approved names. The brand name is the name assigned by the manufacturers and his property or trademark. One drug may have multiple proprietary names. For example, when you consider Altol, Atcardil, Atcor, Aten, Betacard, Lonol, Tenolol, Tenormin for atenolol from different manufacturers. Though the chemical composition of drug remains the same, the brand name will be provided by the manufacturers. Dosage forms of drugs. Dosage form is a product suitable for administration of a drug to the patient. Dosage form of drug mainly stands for the required amount of a drug in any form which is suitable for the patient. Every active ingredient has to be formulated by adding other substances. For example, excipients, diluents, preservatives, and vehicle, according to a specific recipe and packaged into a specific dosage form, such as in tablet form, elixir, ointment, injection, vials, which are then administered to the subject as per the need. This form provides body to the drug. demarcates single doses, protects the active ingredients, and makes it suitable for administration in various ways. The important dosage forms are the solid dosage form, liquid, semi-solid, and inhalation form. The powder form in this drug is in a dry and finely pulverized state. If the drug is for oral administration, each dose has to be wrapped separately or packed in sachets in powder forms. Therefore, this dosage form is inconvenient and unpopular except when the quantity is several grams. For example, oral rehydration salts, powders for topical application are supplied as bulk powders. Effervescent powders contain granulated sodium bicarbonate and citric or tartaric acid. They react when dissolved in water to liberate carbon dioxide, causing bubbling. In tablet form, drug is powdered or granulated, mixed with binding agents and other excipients, and compressed or modulated into discoid, oblong, or other shapes suitable for swallowing usually. The tablet may be plain or it can be sugar coated just to avoid that bitterness so that it will be convenient for the patient for the regular use. Sustained release tablets contain drug particles which are coated to dissolve at different rates. So, at certain interval of time, the drug is dissolved into the body and it attains the peak in the blood. In controlled release tablets, a semi-permeable membrane controls the release of the drug. Other specialized gastrointestinal therapeutic systems have also been developed for this. What are the pills? These are archaic dosage forms in which the drug powder is mixed with honey or a syrup to make a sticky mass. This is then rolled into a spherical or oval bodies meant to be swallowed. The term is often loosely applied to the tablets as well. Pills and tablets most commonly used. Capsules are water soluble cylindrical containers made of gelatin, which are filled with powdered or liquid medicament. The container dissolves on swallowing so that the drug is released in the stomach. Entry coated capsules are designed to dissolve only on reaching the ileum. Spansules are extended release capsules which are packed with granules of the drug having a different coating to dissolve over a range of period. What are the lozenges? These are the tablet-like bodies of various size and shapes containing a drug along with a suitable gum, sweetening and flavoring agents. They are to be retained in mouth and are allowed to dissolve slowly, proving the drug for local action in the mouth and throat. Suppositories. These are conical, bullet-shaped dosage form of insertion into the anal canal in which the drug is mixed with a moldable firm base that melts at body temperature. Oval or suitably shaped bodies for vaginal insertion are called pessaries, while elongated pencil-like cones meant for insertion into the male or female urethra are called bogies. Liquid dosage forms. Aqueous solutions, they contain drug dissolved in water, may be meant for oral, topical, or parenteral administration. Oral drug solutions often contain sweetening and flavoring agents. Preservatives have to be mostly added because shelf life of watery solution is short. Suspensions are dispersion of insoluble drugs in water with the help of a suspending agent. Emulsions are a uniform mixture of two immiscible liquids, mostly oil and water usually, in which droplets of one that is a dispersed phase are suspended in the other, that is a continuous phase, with the help of amphiphilic emulsifying agent. Milk is naturally occurring emulsion. What are the elixirs? These are the hydroalcoholic solutions of drugs, usually sweetened with syrup and flavored by fruit extracts. Syrups have high concentration of sugar and are thicker in consistency. Linctus is a viscous, syrupy liquid meant to be licked slowly for soothing the throat. Drops, these are relatively more concentrated solution of medicaments meant for oral ingestion or external application to eye, nose, or ear canal. Oral drops are the preferred dosage form of infants and young children. Eye or nasal drops should be isotonic. Eye drops must also be sterilized. These are supplied in vials with a nozzle or along with a dropper usually. The lotions, these are the solutions or suspensions or emulsions meant for external application on the skin without rubbing, generally have soothing, protective, or emollient property. Liniments are similar preparations which generally contain counter irritants and are to be rubbed on the skin for the pain relief. The injections, these are sterile solutions or suspensions in aqueous or oily medium for subcutaneous or intramuscular administration, while only aqueous solutions are suitable for intravenous injection because particles in suspension and oils injected intravenously can cause embolism. How these are supplied? These are supplied in a sealed glass ampules or airtight rubber capped vials. Ampules are broken just before the injection and usually contain a single dose. Drug from the vial is sucked in a syringe by piercing the rubber cap. Vials may be single or multi-dose. Drugs which are unstable in solution can be supplied as dry powder vials. Sterile solvent is injected in the vial just before it is to be injected, and the dissolved or suspended drug is then sucked out into the syringe. Large volume intravenous infusions are marketed in glass or polypropylene bottles. Let's move to the semi-solid dosage forms such as ointments. These are greasy semi-solid preparations meant for external application to the skin, even to the eyes, nose, usually the nasal mucosa, ear, or anal canal. The drug is in this incorporated in an oily base such as soft or hard paraffin, wool fat, or beeswax, etc. Ointments are not suitable for oozing surfaces because they do not allow evaporation of water. Creams are similar to the ointments, but the base is water in oil emulsion. Pastes are also the non-greasy preparations of thick consistency containing hydrophilic adhesion powders such as starch, prepared chalk, or aluminum or magnesium hydroxide, zinc oxide, carboxy methyl cellulose, which swell by absorbing water. Paste may contain viscous, non-oily liquids like glycerol or propylene glycol, may be applied to unbroken skin, oozing surfaces, mucous membranes. These are items of personal hygiene, and medicated toothpaste are extensively used in dentistry in paste form. The medicament is in case of gel is incorporated in a viscous colloidal solution of gelatin or similar material, usually dispensed in collapsible tubes. They are meant for external application to the skin or mucosa and provide longer duration contact. And are non-greasy. These are washable with the water. Gels are commonly applied to oral ulcers because they are better retained than aqueous solutions in case of oral cavity. What are the inhalations? These are the drugs with the gases or volatile liquids can be administered by inhalation carried into the air or oxygen with the help of mouthpiece, face mask, hood, or endotracheal tube. Non-volatile liquids and fine particle solids can also be aerosolized using metered dose inhaler, jet nebulizer, rotaler, and spinhaler for inhalation through the mouth. Pressurized metered dosage inhalers are handheld devices which are which use a propellant, mostly hydrofluoroalkyl, and deliver a specified dose of the drug in aerosol form per actuation. Jet nebulizers produce mist of the drug solution generated by the pressurized air or oxygen. These are the various types. Rotaler is also a portable device in which the capsule containing very fine powder of the drug is punctured during actuation, and the released particles are aerosolized by the inspiratory airflow of the patient. A propellant can also be used in some spinhalers. Efficacy of aerosolized drug depends on the particle size, usually 1 to 5 micron diameter particle deposit on the bronchioles and effectively deliver the drugs. Larger particles settle on the oropharynx, while lesser than 1 micron particles do not settle anywhere and are exited out. So these are the various dosage forms of the drugs. So what are the prescription and non-prescription drugs? As per drug rules, majority of drugs, including all the antibiotics, must be sold in retail only against a prescription issued to the patient by a registered medical practitioner. These are the certain rules and regulations put forward by the Pharmacology Association, so that it will be genuine for the patient, and it will be always feasible to obtain a required amount of dosage. These are called prescription drugs. In India, they have been placed in the Schedule H of the Drug and Cosmetic Rules as amended from time to time. However, few drugs like simple analgesics like paracetamol, aspirin, antacids, laxatives, vitamins, parasols, these are considered relatively harmless and can be procured without the prescription. These are non-prescription or over-the-counter drugs and can be sold even by the grocery stores. So this is the difference being the prescription and non-prescription drugs. What are the routes of drug administration? Most drugs can be administered by a variety of routes. The choice of appropriate route in a given situation depends both on the drug as well as patient-related factors. Mostly, common sense considerations, feasibility, and convenience dictate the route to be used in any situation. Which are the factors those control or signify the choice of route? The physical and chemical properties of whether it is solid, liquid, or gas. It's a solid, liquid, or gas. It's a solubility, stability, pH, and irritancy. Site of desired action, whether it is localized and approachable or generalized and not approachable. Rate and extent of absorption of the drug from different routes. Effect of digestive juices and first pass metabolism on the drug. Rapidity with which the response is desired. Routine treatment or emergency. Accuracy of dosage required. Intravenous and inhalational can provide fine tuning. Condition of the patient, whether patient is conscious, unconscious, vomiting. These all factors will decide the route of administration of the drug. The routes can be broadly divided into local routes and the systemic routes. The local routes can be used for localized lesions, which are accessible sites, and for drugs whose systemic absorption from these sites is minimal, slow, or absent. Thus, high concentrations are attained at the desired site without exposing the rest of the body. Systemic side effects or toxicity are consequently absent or minimal with this. For drugs that are absorbed from these sites or routes, the same can serve as a systemic route of administration. The local routes of drug administration are the topical, This refers to the external application of the drug to the surface for the localized action, like any balm. It is often more convenient and efficient mode of delivering the drug to the skin or oropharyngeal or nasal mucosa, eyes, ear, canal, anal canal, even the vagina. Non-absorbable drugs given orally for action on GI mucosa, such as neomycin, inhalation of drugs for action on bronchi, salbutamol, and irrigating solutions or jellies, such as povidone iodine. In dental practice, antiseptics, astringents, hemostatics are often applied as paints, toothpaste, and mouthwashes, gargles, or lozenges. For the deeper tissues, areas can be approached by using the syringe and needle, but the drug should be in such form that the systemic absorption is slow and it will reach to the required site, like infiltrations around the nerve or intrathecal injections of lidocaine or amphotericin B, intra-articular injection of hydrocortisone acetate, or retrobulbar injection of hydrocortisone acetate. Arterial supply, such as close intra-arterial injection, is used for constant media in angiography. Anti-cancer drugs can be infused in femoral or brachial artery to localize the effect of limb malignancies. These being the local routes of drug administration. What happens in case of the systemic routes, such as the oral route? The oral injection is the oldest and the commonest mode of drug administration. It is safer, more convenient, it does not need any assistance, non-invasive, often painless. The medicament need not be sterile and it is most cost effective. Both solid dosage forms such as powders, tablets, even the capsules, spansules, druggies, molded tablets, gastrointestinal therapeutic systems, etc. The liquid dosage forms such as elixir, syrups, emulsions, mixtures can also be given orally. Sublingual route or the buccal route. In this, the tablet or a pellet containing the drug is placed under the tongue or crushed in the mouth and spread over the buccal mucosa for its rapid action. Only lipid soluble and non-irritating drugs can be administered in this way. Absorption is relatively rapid. Action can be produced in minutes with this sublingual route of drug administration. Though it is somewhat inconvenient, one can spit the drug after the desired effect has been obtained. The drawback being this, the chief advantage is that the liver is bypassed and drug with a high first pass metabolism can be absorbed directly into the systemic circulation with a sublingual mode of drug administration. Usually, the glyceryl trinitrate, buprenorphine, and desminooxytocin. These are the drugs which are administered usually with this route of drug administration, sublingual. In case of rectal administration, certain irritant and unpleasant drugs can be put into rectum as suppositories or retention enema for systemic effect. This route can also be used when a patient is having recurrent vomitings. However, it is rather inconvenient and embarrassing. Absorption is slower, irregular, and often unpredictable, though diazepam solution and paracetamol suppository are dependently absorbed from rectum in children. Usually, this mode of drug administration is recommended in children, though it is used in adults as well. Drug absorbed into external hemorrhoidal veins bypasses liver but not that absorbed into the internal hemorrhoidal veins. Rectal inflammation can result from irritant drugs. The most common drawback: indomethacin, diazepam, ergotamine, and other fewer drugs sometimes given rectally. Cutaneous route of drug administration. The highly lipid soluble drugs can be applied over the skin for slow and prolonged absorption. The liver is also bypassed. The drug can be incorporated into an in an ointment and applied over the specific area of skin. Inhalation mode of drug administration. In this, volatile liquids and gases are given by the inhalation for systemic action. For example, general anesthesia. Absorption takes place from vast surface of alveoli. Action is very rapid. When administration is discontinued, the drug diffuses back and it is rapidly eliminated in expired air. Thus, controlled administration is possible with the moment-to-moment adjustment with this inhalation mode. Drawback being the irritant vapors cause inflammation of respiratory tract and increase secretion. The nasal mode, the mucous membrane of the nose can readily absorb many drugs. Digestive juices and liver are bypassed with this route of drug administration. However, only certain drugs have been used by this route. Then the parenteral route, it is conveniently, parenteral refers to administration by injection, which takes the drug directly into the tissue fluid or blood without having to cross the internal mucosa. The limitations of oral drug administration are circumvented in this. Drug action is faster and surer. Gastric irritation and vomiting are not provoked through this. Parenteral route can be employed even in unconsciousness. Uncooperative patients or patients with vomiting, there are no chance of interference by food or digestive juices, and liver is bypassed with this. The disadvantage of parenteral route are the preparation has to be sterilized and is costlier. The technique is invasive and painful. Assistance of another person is mostly needed, not like oral, which in which patient can manage by himself. There are chances of local tissue injury and generally it is more risky than oral. The most important parenteral routes being the subcutaneous, intramuscular, and intravenous intradermal injections. Subcutaneous form of drug administration, the drug is deposited in the loose subcutaneous tissue which is richly supplied by the nerves, but it is less vascular. Self-injection is possible because deep penetration is not needed in this subcutaneous mode of injection. The this route should be avoided in shock patients who are vasoconstricted. Absorption will be delayed. Repository preparations, oily solutions, or aqueous suspensions can be injected for prolonged action. So, subcutaneous mode of drug administration is referred. Some forms being use of dermojet, pellet implantation, or CLA stick, and biodegradable implants. Intramuscular injections. In this, the drug is injected in one of the large skeletal muscles, like in case of deltoid or triceps, gluteus, maximus, rectus. Muscle is less richly supplied with sensory nerves and is more vascular. It is less painful, but self-injection is often impracticable. As deep penetration is needed, depot preparations can be injected by this route. Intramuscular injection should be avoided in patients taking anticoagulant medications. Every form of dosage administration has few advantages and few disadvantages. So it is always advisable to look for what are the adequate and most appropriate route of drug administration in a particular patient whenever you are selecting or preferring any mode of drug administration. So the intravenous mode of drug administration, in this, drug is injected as a bolus or infused slowly over hours in one of the superficial veins. Drug in this directly reaches into the bloodstream and effects are produced immediately. The intima of veins is insensitive and drug gets diluted with the blood. Therefore, even highly irritant drugs can be injected intravenously, but hazards being the thrombophlebitis of the injected vein or necrosis of adjoining tissues if extravasation occurs. These complications can be minimized by diluting the drug or injecting it into a running intravenous line. Only aqueous solutions can be injected intravenously, and there are no depot preparations for this route. The dose of drug required is smallest usually, with a bioavailability of 100%, and even large volumes can be infused IV. One best advantage with this route is in case response is accurately measurable and the drug short acting, titration of the dose with the response is possible. However, this is the most risky route if vital organs like heart, brain, etc. get exposed to high concentrations of the drug. It and has the possibility of causing air embolism is going to be the drawback with this route of drug administration. In case of intradermal injections, the drug is injected into the skin, as its name signifies, into the skin, raising the web or entering multiple contours of the epidermis through left scarring multiple through a drop of the drug is done. This route is employed for specific purposes only. So these being the various modes of drug administration, I have just enlisted the local routes and the systemic routes. This is just a classification of dosage forms and routes of drug administration. In exam, many a times it's been asked various routes of drug administration. You need to remember the mode of drug administration, broad classification, and example of each mode of drug administration. This is a quick chart for you all to revise during your examination. So CM Dental Academy is come up with a fresh batch for dental students, beginning with this December for first, second, third, and fourth BDS students. The course is conducted by providing descriptive notes in this form. A PDF document of descriptive notes is being formulated, which is which mainly composed of material from all the standard textbooks recommended by the DCI. These are the form of a notes. The viva voce questions, most commonly asked viva voce questions during your examination, will be enlisted per chapter wise, and answers will be mentioned then and there only, so that it will be easier for you to prepare during your exams. These we are going to be provided per chapter wise. MCQs for that. It will be easier for you to prepare from right now for your postgraduate NEET exams, competitive exams in this form. For this, we'll be having a separate Telegram group in which at the end of particular chapter in particular subject, all the MCQs will be released so that you can solve them anytime. Along with this, the previous year question papers of your respected university will be solved. Pre-recorded lectures will be provided so that you can revise till your exam dates. Any doubts, you can join back our mentors anytime on WhatsApp and Telegram groups for discussions. Limited students per batch we are restricting so that we can provide the complete support till the exam for the preparation of the subject. These are the main highlights of this regular course, which we are going to begin from this December. I would like to conclude. Your future is created by what you do today and not by tomorrow. So let's begin a journey towards success. Thank you.